this video, we're going to look at navicular stress fractures, which is a tiny little bone in the bridge of your foot. Now, we're going to look at why does this bone get injured so easily in certain types of sport, why it doesn't heal that well, and why is it seen as a high-risk stress fracture. Then we're going to take a look at what's the most common causes for this. And then finally, we'll also look at what treatment options you have, either conservative and surgical, and what are the arguments for which, and how long you can expect your recovery time to take. So for those of you who don't know me, my name is Maryke. I'm one of the physiotherapists from sportsinjuryphysio.com, where you can get online physiotherapy assessment as well as treatment for your injuries. Have a look at the description of this video if you want a link to our website. Okay, so where is the navicular bone and what does it do? If you look at your little bones in your foot, the navicular bone is right on the bridge, right on the inside there, and it's quite a large little bone compared to the rest of them. It takes a lot of strain, and it's kind of in the center of all the weight transferring movements when you play your sports. And navicular stress fractures is very common in people who play sports that has a lot of changing of direction in it, or jumping sports and quite fast push-off. But it's also common in long distance runners. Now, if you look at the blood supply of the navicular bone, you have good blood supply on the one side, good blood supply on the other side, but then you have a zone in the middle that doesn't quite have such good blood supply. And it's that area that's vulnerable to overuse injuries. And the reason for that is it takes a bit longer for that part of the bone to recover. So if you're doing high volumes of training and you're not allowing enough recovery time, that's the bit that's going to strain the most. And also, if you do, it won't have the strength to deal with really sudden increases or large increases in volumes if you've not built it over time. So what's the main causes for this? I've touched on it basically, that overuse is the major cause of that. So you're not giving it enough time to recover, or there's something, you've changed your shoes and there's for some reason now your foot is suddenly inverting a lot, pronating a lot more and putting more strain on there. So there's some change in your normal environment that makes that part work harder and not allowing it to recover enough. Now, certain things like overpronation can predispose you to it. Also, there's some research to show that if you've got a stiff ankle joint that doesn't want to dorsiflex so much, that can predispose you to it. Now, on that note, some people just has feet, especially guys with or people with really high arches. They have an anatomical reason for their foot being stiff and they can't really improve that range of motion. So it can be useful if the clinician you're working with thinks that that's part of the cause for yours. It could be useful to see a podiatrist because they can help adjust your footwear that it takes some strain off that. But that's just one part. Then other things you want to be thinking about is vitamin D levels as well as the food you take in. So vitamin D is really important for us to in our bodies to have strong bones, because you can take in all the calcium you want, but you can't actually absorb it from your gut if you don't have enough vitamin D. Now, we get vitamin D naturally from the sun. It gets produced in your skin. But if you wear sunblock every time you go out in the sun, or you live in areas that you don't really see much sunshine, especially in the winter time, there's quite a lot of research to show that athletes in Europe are vitamin D deficient in the wintertime. Even athletes in places like Israel, where there's a lot of sun, because they don't train in direct sunshine or they cover themselves up when they're in the sun, they can be vitamin D deficient. So it's something that your doctor can test for you. Have a look. If you've got a stress fracture, it's always good to look at vitamin D levels. The other thing that's really important, and especially for people who does endurance sports, is that you check that you're actually getting enough energy into your diet. So there's strong research now to show that for both males and females, if you have what we call a relative energy deficiency, the acronym for it is RED-S, all it means is that over a long period of time, you're taking in fewer calories than what you burn. Your body thinks that you're in a starvation phase. So what it then does is it shuts off processes that it doesn't see as essential for survival. And one of those processes is the process of renewing your bones. So every time you train, you're getting little bits of micro damage in all your tissue, including your bones, but your body's got to repair that then. But now your body's thinking you're starving, so it's not repairing the damage from exercise. And that's one of the main reasons why people do end up with stress fractures. So if you think you may possibly not have been taking in enough energy, it's worth consulting somebody who works with sports nutrition and just checking how can you adapt your diet to, first of all, help your recovery from the stress fracture, but secondly, to avoid it in the future. Good, so let me see what I'm leaving out. What are the symptoms of a navicular stress fracture? So the first thing that you'll feel is you'll feel pain over the bridge of your foot, more towards the inner part of the foot and sometimes even along the inside of it. It can be underneath as well, but it's not a pain that you can easily say, here it is, or, that you really clearly know. It can just feel like this dull ache that you don't know where it is. Sometimes it can be a bit sharp when you push on this or press, step on it as well. It can sometimes get confused with plantar fasciitis if it gives you pain underneath the foot. It can be confused with things like tib post tendinopathy, because both of them can give you pain on the inside of your ankle, or tib ant tendinopathy, which is tendinitis or tendinopathy you get in the tendons that run over the bridge of the foot. So those are things that a clinician can help you identify and differentiate between. Now, what was I going to say? Oh, yes. The other important thing is the pain doesn't start with a sudden thing. So it's not that you step on your foot and suddenly you feel a sharp pain. This ache or pain you feel with activity usually builds slowly over time. And it's usually at the beginning, just when you do your sports or just when you stand a lot or walk a lot. But as it progresses, it can become painful when you're just sitting or sleeping. So it comes in various forms depending on how long you've had the injury for. How to diagnose it? Well, a skilled clinician should be able to listen to the history you're telling them, plus do some tests to check that it's not the other things we've just spoken about, like the tendinopathies. And then there's a test where if you press directly on the navicular bone from the top, if that's painful, what the research is showing is that it's very likely that you've got a stress fracture then. However, if it's not painful, it doesn't rule it out. It just means that you've got to do further investigations then. But if it is painful when you press directly on the navicular bone, it's likely that you've got a stress fracture there. Then the first step is to get an X-ray. Now, X-rays aren't that sensitive for stress fractures. They can easily be missed on it. Why do we do an X-ray? Because it can pick up other things. So it can pick up coalition of the tarsal bones, which means that you've got an anatomical reason why there's differences in bones that's kind of pressing on each other. Or it can pick up things like growths. It can pick up osteophytes. So even though you can't rule out a stress fracture if it comes back not showing one, it can show you other things that's useful. But then an MRI scan is the gold standard to pick up stress fractures, because also you've got to remember that actually before you get to the stage where the bone fractures, you get what we call a stress reaction in the bone. And if you look on an MRI scan, if a bone has a stress reaction in it, it's just going to show you a really angry part in that bone, and it's not going to show a fracture line at that point. And only MRI scans can really pick that up. So X-ray can't show that for you. And then also, MRI scans are better at sometimes this, depending on how the fracture lies, it's just lying in a position where the X-ray doesn't pick it up, whereas MRI scans can do that. So that's really the gold standard to be diagnosing it with this. Good. So now you've got the unfortunate diagnosis of it is a navicular stress fracture. What are your treatment options? The researchers are having a little bit, or clinicians are having a little bit of an argument between whether you should go conservative first and then surgery, or surgery in all cases. So I'm going to talk about both because I think it's important for everybody to make their own informed decision about this. So let's talk about conservative management first. The first step in that is that you get immobilized in a boot for at least 6 weeks, but often actually 8 weeks, with absolutely no weight bearing through that foot. Now, it doesn't help to cheat because it may not be painful to weight bear through it, But what the research is showing, remember that blood supply isn't great in there. If you want the conservative treatment to be successful and avoid surgery, you have to put absolutely no weight through that foot for at least 6 weeks, but likely up to 8. Then, once you come out of that boot, you've now had 6 to 8 weeks of no weight through it. So you would have lost muscle strength in your foot, you would have lost muscle strength around your ankle, and perhaps, well, ideally your physio will help you with exercises that you can do to strengthen the rest of your body that doesn't put weight through that. But you have got to improve the strength and control in those muscles first, otherwise you will end up injuring your foot and ankle again. So the first step is then to do exercises that strengthen the intrinsic muscles of your foot, as well as the muscles that control your ankle. So strength is one aspect. The other aspect is you've got to do proprioceptive exercises. Now, although it's a mouthful, all it means is it's balancing type exercises that helps your brain to connect to your foot and ankle again. Proprioception is that ability that when you close your eyes, you know exactly where your fingers are, your toes are, your feet are, everything. Now, what we don't actually realize is every step we give, our brain has to calculate exactly at what speed you're moving at, what position your foot is, what position you're going to hit the ground, so that it can activate the muscles in the perfect rhythm, as well as with the perfect intensity for that job. So it's really complicated. Now, when you've had an injury like this, and especially if you've been immobilized in a boot or plaster cast for a while, your brain loses a little bit of that connection to that body part. And you've got to re-stimulate it and rebuild it. And it's really easy to do if you're very diligent with your balancing exercises. So you would start with easy, simple things. I despair sometimes because as soon as people hear balancing exercises, they think, oh, balance board, let's get on really unstable surfaces. No, you start with stable surface. Can I keep my balance on one foot on the floor without wobbling and looking like this? If you can't do that, there's no ways that you should be progressing to anything unstable, because you'll just injure yourself. You've got to master the easy things first. Again, a physio will help to guide you through that. So then the other thing to remember is that while it's immobilized and while you're not putting weight through the foot, your bones and everything will also just go, nah, we don't have to be that strong at the moment. And we're not used to weight bearing anymore. A little bit like an astronaut coming back from space, not that severe. But you will have to load it slowly over the next few weeks to get it used to load bearing and get those bones to recover and rebuild themselves nice and strongly again. This whole process will take you about 12 weeks from the moment you come out of the boot to the moment that you're ready to return to your full sport. And an important thing to remember is 12 weeks may sound long, but that's the regular time that people will take when they go from totally unfit to really ready for sport if they don't want to get injured. So we're looking for conservative treatment to take you around 5 months. If you take that you've got to be in the boot for 2 months, well, 1.5 to 2 months, and then you've got to take your time with your rehab to ensure that you don't just end up overloading the bone again and that you get all your strength back. At the same time, remember to think about supplements, think about your energy deficiency, all of those elements feed into this. Now, why may some people consider surgery to be a better option than conservative treatment? The reason being that the conservative treatment takes such a long time. So some people argue that no, if we've got a top level athlete who can't take that much time out, bang them into surgery and the recovery time is a bit shorter. Now, it's important to realize that it's not shorter by much. It's not going to get you back to training full on and competition within 6 weeks. It's usually about, I think the research showed that it's about 3.5 months versus 5 months recovery time. So you're saving roughly about 6 weeks. And the typical surgery they'll do is they'll go in and put a pin in, small pins or screws, sometimes do a bone graft as well. Now, whenever you do surgery, there can be complications, and we don't quite know what the long-term, so several years even after you stop competition, what the effect on your foot will be from that. So that's why some clinicians reckon that it's better to try the conservative treatment first and allow your body to heal itself in the natural way. And then only if that fails do you consider surgery. But this is something you've got to decide for yourself and discuss with your doctor which route you want to take. Hope you found this useful. Let me know if you've got any questions. And remember, if you need more help with an injury, you're welcome to consult one of the team via video call. The link to our website is in the description of this video. Take care.